नमस्कार दोस्तों, मैं हूं डॉक्टर गुलाब। आप सबका हमारे हेल्थ टॉक शो में स्वागत है। हर दिन की तरह आज का दिन है खास, क्योंकि मेरे साथ में है खास इनवाइटी। हमारी सीनियर है डॉक्टर क्षमा। इन्होंने अपना BNYS 2005 में ग्रेजुएट किया SDM कॉलेज से, जहां से हमने किया। हमने 2009 में ग्रेजुएट किया। ग्रेजुएशन BNYS कंप्लीट करने के बाद इन्होंने PG डिप्लोमा किया एक्यूपंक्चर में। एक्यूपंक्चर में डिप्लोमा करने के बाद में आज खुद का क्लिनिक रन कर रहे हैं। ये फाउंडर डायरेक्टर हैं रिद्धि नेचर क्योर क्लिनिक बैंगलोर। ज्यादा समय न वेस्ट करते हुए हम इनवाइट करते हैं हमारे स्पेशल इनवाइटी को, डॉक्टर क्षमा जी को। आपका बहुत बहुत स्वागत है हमारे शो में मैडम।
थैंक यू डॉक्टर गुलाब, इट्स अ प्लेजर टू बी हियर।
Yes, and same here. It is a pleasure for our health talk show that we are hosting you today. And our viewers would like to know that how you came in naturopathy and did the graduation. Though the awareness about the naturopathy was very less at that time when you have joined the naturopathy. So what made you to come in this field?
Okay. There were many influences, multiple reasons for me to join naturopathy, but the biggest influence was my father. He has been and had been an ardent naturopathy follower, and for a couple of years, for ages, he used to get himself admitted in Nature Cure Hospital, Shantivana, for 8 to 10 days, get himself rejuvenated and get back home with a new zeal. And I always wondered why and how, until I was admitted in Nature Cure Hospital at the age of 14 for appendicitis. I used to get the symptoms of excruciating abdominal pain, nausea and vomiting, because of which I had to miss school, and I was also advised to go for a surgery. So surgery at that age is a little scary. So as a last resort, we thought of taking naturopathy treatment, and I got admitted for 8 days, and miraculously, fortunately, till date I haven't got those symptoms back.
That's very nice.
That is how I developed faith in nature cure, and I got to know that nature cures. Yeah.
So how you got the idea to open the clinic? Because how you thought about that you can go for the clinic running?
I always wanted to have my own clinic, but prior to that, I worked in a couple of organizations. I worked as an RMO at Mysore, Indus Valley Ayurvedic Center, for a year. I got some experience from there, from both naturopathy and Ayurveda. And then back in Bangalore, I also worked for fertility and still associated with them, with Fertility Center. And also I was working as a yoga coach in a yoga studio. And then starting your own practice is an exciting way to take up treatment and practice in your own hands. Though it is a bit challenging, it is more rewarding than anything to heal someone and make a difference in people's life. Also, it allowed me to have the flexibility of time. That is why I started my clinic.
So now coming to today's talk, that as you know, so many people are suffering with the thyroid problem. Few are suffering with hypothyroidism, few are suffering with hyperthyroidism. So today's talk, we have taken that heal thyroid with naturopathy and yoga. So have some highlights. What are the diseases which are being covered in the thyroid? What are the causes? How it is impacting the human body, and how to overcome with this.
Okay. You're absolutely right. According to the clinical surveys from various studies done on thyroid disorder, it is evaluated and estimated that 32% of the Indian population is suffering from thyroid disorders. And incidentally, women are 5 to 8 times more likely than men to be diagnosed with this disorder, which is a sad plight, of course. Let's first understand what is thyroid and how does this gland work. Thyroid is a very small butterfly-shaped gland just under the Adam's apple near the throat. Now, there are a network of glands in our body which secretes and synthesizes hormones. And these hormones have a specific role to play in our body. Similarly, thyroid gland also produces two such important hormones, T4 and T3, that is thyroxine and triiodothyronine. The thyroid stimulating hormone, which is produced in the pituitary gland, this further stimulates the thyroid to secrete the hormone into the bloodstream. Now the function, despite the small size of this gland, it has humongous role to play in metabolism, in maintaining the body temperature, in growth, in mental health, in heart and muscle strength, and also the uterine activity. So it basically determines how our body functions and ultimately how we feel. So it impacts major systems of our body. So too much or too little of this hormone can make a major impact in our well-being. Now, what causes the overactivity or underactivity of the thyroid gland? There are two main factors or reasons most commonly, that is autoimmune disorder, and the other one is nutrient deficiency. Now, autoimmune disorder, here the immune cells, which are otherwise expected to protect the thyroid tissue, it instead attacks it and inhibits the production of hormone. So these are Hashimoto's thyroiditis and Graves' disease. In Hashimoto's thyroiditis, there is underactivity of this hormone and it leads to hypothyroidism and a very common disorder. In Graves' disease, there is overactivity of this hormone and it leads to hypothyroidism. Now coming to the second most common reason, that is nutrient deficiency. As you know, iodine is the crucial nutrient which leads to hypothyroidism. Now, deficiency of iodine can lead to swelling of the thyroid gland, which is called as goiter. Similarly, there are two other nutrients, zinc and selenium, the deficiency of which also causes the malfunctioning of thyroid. There are other reasons like genetic factor, there are factors, environmental factors, and also unknown. Now, the
So
key.
one thing I will just ask here. When we are talking about the causes, does the lifestyle impact to the functioning of thyroid gland?
Definitely yes. The sedentary lifestyle, which most of us are having right now, the youngsters, and that is why the people between 20 to 30 are most likely to get this disorder now because of the stress, because of other factors like sedentary lifestyle, no exercise, bad food habits, processed food, so on and so forth. Now the key to find the best treatment all depends upon the correct or accurate diagnosis. If the diagnosis is not right, then the treatment becomes ineffective and all your efforts, all your money will go futile. Unfortunately, the thyroid symptoms mimic lot of other health conditions. So most common is misdiagnosis in this condition. So what happens is the symptoms are very vague. A person who is having depression because of hypothyroidism, without understanding the underlying issue, he might end up going to a psychiatrist and pop in some antidepressant and still not be okay. Similarly, a hyperthyroidism patient will have the symptom of palpitation, that is increased heart rate, and he might go to a cardiologist thinking it is something related to cardiovascular disease. And a person who is obese, whose metabolic rate is low because of hypothyroidism, might go to a dietitian or a nutritionist and try hard to lose weight, but in vain. and it might also lead to depression. But the unifying cause of all this is thyroid. So proper diagnosis, proper evaluation is the key here.
So now here,
And
yeah,
yes, please tell.
if we go for the diagnosis, like as you gave the very nice comparison that how it is being misdiagnosis. Sometimes the depression patient will go to the psychologist and they will not rule out the. Now, for example, if we need to find or early screen it, that the person is suffering with the thyroid problem, either the overworking or the underworking. Now, what are the comparative sign and symptoms which can be observed in the person, either the thyroid is functioning hyper or hypo? So can you just list down some of the symptoms which can be very commonly observed during the thyroid problem?
Sure. Yeah, the most common disorders with the malfunctioning of thyroid is one is hypothyroidism, hyperthyroidism. Then there is goiter and thyroiditis also. But the prevalence of hypothyroidism is much more in India as compared to other countries. One of the biggest reason is iodine deficiency, which is mostly seen in the northern part of India. But since the introduction of iodized salt in the year 2006, the prevalence has gradually come down, but still 40 to 43 million people still suffer, which is a big number. Now, like you said, there are particular symptoms in hypothyroidism and hyper. In hypothyroidism, a person might have fatigue, he will have depression, he might be obese because of low metabolic rate. He will have symptom of constipation because of low gastrointestinal activity, hair fall, apathy, forgetfulness, brittle nails, and intolerance to cold. Also, irregular menstruation in women because of low uterine activity, and also a complication of infertility. So, if a person is infertile or she's unable to conceive, then she definitely has to get her thyroid tested also. That also is an underlying reason. Now, in hyperthyroidism, a person will have almost the symptoms and signs are quite opposite to hypo. The gastrointestinal activity is very high, so a person will have diarrhea. Metabolic rate is very high, a person will have weight loss. Then there is palpitation, increased heart rate, high blood pressure, and temperature, high temperature, and he might or she might have hot flushes. And there is a very prominent feature in hyperthyroidism called as exophthalmos, where one or both the eyeballs protrude out. This is a peculiar sign of hyperthyroidism. Now, the key to all this is proper diagnosis. Fortunately, there are quite a few diagnostic methods or tests to understand if these symptoms are because of thyroid disorder or not. The first and key or the crucial testing is through case history taking or a case study. Here, both the physician and the patient should be tolerant, and the patient shouldn't be hesitant to reveal his signs and symptoms. And then comes the physical examination. Here, you can even find out problems like goiter with the swelling of the thyroid gland. He can rule out goiter with physical examination. The next is blood test and then the ultrasound or imaging test. Now, the definitive way to find out is the easiest way is through blood test. You can get your T3, T4, TSH, and even T3RU. Now, if additional tests are required to further probe into the disorder, then there are tests like thyroid antibodies to rule out autoimmune disorder. And there is calcitonin test to rule out cancer, thyroid cancer. And there is a thyroglobulin test to rule out thyroiditis. Now, if there is any functional imbalance in the blood test because of the thyroid gland, one can get an ultrasound done to the thyroid gland and rule out structural abnormalities in the gland. And always please remember to get your vitamin D and vitamin B12 also tested along with this, because when the thyroid malfunctioning is not treated for a very long time, there are high chances of dampening of vitamin B12 with vitamin D in your body.
So this is the best way how we can go for testing the thyroid functioning, and once it is ruled out in the early stage, then the best treatment can be given. And if it is being ignored or delayed, then definitely that treatment also require the more time for treating it. So here what I suggest, like now we have spoke about all the causes and diagnosis and sign and symptoms also. So can you just put some highlights that how to overcome with these problems? Because solution, if we are giving it, and as in naturopathy we say prevention is always better than cure. So we will talk about the preventive aspects also and curative aspects also. So first we will talk what treatments or how you are managing it, and then we will talk that how we can prevent it, that we should not get the thyroid problem at all.
Yes.
So first we will talk about the management. Yeah.
Okay. See, in conservative medicine, a person who is suffering from thyroid abnormalities will be given a hormonal replacement or a thyroid substitute. But in the long run, what happens is this can inhibit the absorption of micro and macronutrients. So how we naturopaths can intervene here? And in functional medicine, we focus on addressing the underlying issue and have an holistic intervention or holistic approach. To start with, nutritional approach or diet. So adequate nutrients are required for the thyroid to optimally work, or for the health of the thyroid. A person who is obese should not get panicked and start, aimlessly start starving and going on long intermittent fast. In the name of intermittent fast, they start fasting like anything, and it might lead to other complications.
Yeah.
So here the goal should be gaining health than losing weight. And the key here is moderation and substitution. So if you're having polished white rice, substitute that with unpolished brown rice, which is low in glycemic index, and it will be less burden to your intestine.
Very nice.
Next, substitute your refined oil with non-refined oil or cold pressed oil. That is because in refined oil, it is high in polyunsaturated fatty acid, and this can lead to complications like high cholesterol and high triglycerides. And in cold pressed oil, why I recommend cold pressed oil? Because here the extraction happens with heat, with pressure, not with heat. So the nutrients will remain intact. And the best oil is coconut oil because it contains lauric acid, and lauric acid is excellent in reducing the inflammation, which is one of the symptoms of Hashimoto's thyroiditis. And also if you can easily get hemp seed oil, that is also a good option. Now you can have 1 teaspoon of coconut oil either in empty stomach or sometime in between your meals. It is a very good option. And now coming to the deficiencies which hypothyroid patients suffer. One is iodine deficiency. Now iodine is mostly found in bananas. So you can consume bananas, strawberries and carrots. The zinc is highly found in avocados, pomegranate and guavas. And then the selenium deficiency, if you're suffering from selenium deficiency, you can opt for seeds and nuts. Nuts like almonds, walnuts, and peanuts in moderation because that is considered goitrogenic. And now the seeds, those are flax seeds, chia seeds, sunflower seeds, and pumpkin seeds. Flax seeds are rich in omega-3 fatty acid, probably the only the vegetarians can find omega-3 fatty acid only in flax seeds, and it is also an excellent regulator of thyroid. And there are few specific things you can have, like concoction of coriander seeds for both who are suffering from hypo and hyper. 1 tablespoon of coriander seeds soaked overnight in 150 to 200 ml of water, and you can consume it the next day morning by straining it. Then, yes, and then you can include more of whole grains, and then include more of fiber-rich food. And there is a popular myth that you should stay away from cruciferous vegetables because that is also considered goitrogenic. But I think it's a myth. If you're cooking it or sauteing it or boiling it, then you can definitely have cabbage, cauliflower, or broccoli, but again in moderation, so that you're not devoid of any nutrients and your nutrition is complete. Now coming to the acupuncture. Acupuncture and yoga both have substantial evidence that these both play a pivotal role in regulating your thyroid. Coming to acupuncture first, in acupuncture medicine, we believe that any disorder in the body is because of the imbalance in the energy channels. So in hypothyroidism, we believe that it is caused by spleen and kidney deficiency, and in hyperthyroidism, it is the deficiency of liver and spleen. So there are few points like sedating points, nourishing points, and soothing points. So we strategize the points according to one's condition, signs, and symptoms, and manipulate the needles, insert the needles, and further also give electrical stimulation if required. We can always couple this with auricular acupuncture also, which is also proven to be helpful. Now there are complications because of hypo and hyper, that is infertility and irregular menstruation, and acupuncture plays a pivotal role in regulating your menstrual cycle and also in infertility. So you can use acupuncture in all these reasons. Now coming to you, yeah. Yes.
Just I wanted to have one thing over here, that as I have heard about you, and you are the expert for treating the infertility through acupuncture. So here I will interrupt and I'll just ask that have some highlights on infertility and how you are treating at your clinic, because it will be a supportive to people or the women, those who are suffering with infertility along with the thyroid problem, so they can approach and they can follow the instructions what you suggest now.
Okay. So just specifying on infertility.
Yeah.
With acupuncture, we can boost the fertility by balancing the hormones. In infertility, the main reason, underlying reason, is imbalance of the hormones. And thyroid is one of the crucial hormone for fertility or for conceiving. So with acupuncture, we try to increase the blood circulation to the uterus, and also the uterine membrane gets enough blood supply with acupuncture. There are certain specific points for that, and there are few tonifying points which we stimulate with electrical acupuncture. Along with this, we intervene with diet and yoga also. So once again, here there is an holistic approach even when it comes to uh, what is that, regularizing your menstrual cycle. That is also important when a person is suffering from infertility.
So if we will talk about the treating the infertility, the first to regularize the menstrual cycle also, and can you just suggest some of the dietary intervention what you use along with the acupuncture in the condition where periods are not being regularized or the person is having infertility? So it will be at least easy for the people and the followers to follow this advice at the home at least, so that they can get good benefit.
Sure. if a person is finding it hard to conceive, then he has to stay away from a certain food, and he has to include few food. He has to include more fiber-rich food, and especially he has to. I suggest those people who are having problem with infertility to include chia seeds and flax seeds. Then substitute wheat, gluten with jowar and bajra, and reduce the intake of rice, polished rice, because it has high glycemic index, and also include seasonal fruits and vegetables, and include more of avocados because that enriches your fertility, enriches your uterus. Include more of pomegranates, apples, and pear. And bananas are also rich in potassium and iodine, so include that also. And stay away from processed food, deep fried food, something which decreases your metabolic rate, because weight is also a crucial point when it comes to fertility.
Yeah.
And yoga postures. Yoga also has substantial evidence to prove that yoga also plays a crucial role in both thyroid regulation and infertility. So there are specific asanas to improve the thyroid health, to optimize the thyroid gland. Those are Sarvangasana, Setubandhasana, Matsyasana, and Bhujangasana, to name a few. And there is a particular pranayama called as Ujjayi pranayama. This also helps in regularizing or regulating your thyroid gland. And specifically in meditation, there is something called as chakra meditation and deep relaxation technique. Chakra meditation, there are 7 chakras, and each chakra is directly and indirectly related to each of the glands in the body. So that will regulate your thyroid gland. Yes.
Okay, so it is the best way to regulate if you do the yoga and you perform the asanas and some of the pranayama practices, then definitely you are going to regulate your thyroid gland. Now here I would like to request you that you can suggest some of the treatments in naturopathy which people suffering with the thyroid problem they can perform at the home, and easy treatments, and how naturopathy treatments are being more effective. So we have talked about the acupuncture, we have talked about diet, we have talked about yoga. Now we will just focus on the naturopathy treatments. I mean to say that hydrotherapy treatments, all based on the Panchamahabhutas treatments, what we are using it. So one, that is the element, that is the earth element as per the diet you have suggested. So I'll come to the water element, and air also you have suggested. So some of the remaining advices you can provide it.
Yes. There's another treatment in hydrotherapy, that is cold compress to your neck. This also works wonders. So what you can do is you can dip a muslin cloth in cold water, squeeze it and place it on your thyroid, that is on your throat region, on your neck region. So that also helps in regulating your thyroid gland. Now coming to mud therapy, even this has been proven that it works excellent in hypothyroidism. So you get, I don't know if it is easily available, but mud therapy is excellent in thyroid dysfunction. So if you can incorporate this, it's really helpful. Now, if you can definitely, whether you are suffering from thyroid disorders or not, try to inculcate these healthy habits, these lifestyle measures, so that you can not only cure and treat thyroid disorders, but also you can prevent thyroid disorder and many other metabolic disorders or lifestyle disorders. Like Dr. Gulab mentioned, our motto or axiom, there is a popular axiom in naturopathy that prevention is better than cure. And please follow that, and you can be away from many disorders.
So now as an expert advice, I'll just would like to ask that for prevention of thyroid problems, or even I will say the infertility, what measures one should adopt as a preventive aspects. In naturopathy, which they can inculcate in the lifestyle. So put some highlights on that.
First is the main reason nowadays why most of the women or men are facing a problem with conceiving or infertility is because of their lifestyle, sedentary lifestyle. They don't exercise, improper diet, that is, there is no fixed time of eating. And whenever they find time, they just have something which is unhealthy. That is one of the biggest reasons. So, what you can do is fix a time for your meal and don't have heavy meals. Instead, break it up as mini meals. So, every 2 hours, have something healthy and munch in, and even during the mid meal, have munch on something very healthy like seeds and nuts or fruits or vegetable juices, and try to finish your meal, that is your dinner, at least 4 hours before your sleep or at least 3 hours before your sleep, and try to uh, add on to your daily routine, that is exercise, any form of exercise for that matter, not necessarily only yoga. Yoga is definitely good because here you're not only doing physical movement, but you're also adding on and focusing on the breath work. This will further relax you and releases the stress, and it also stimulates a happy hormone called as serotonin from your brain, which will help you to have a proper sleep pattern, and you can have a sound sleep, which is also one of the reasons for stress. So introduce yoga or any physical form of exercise and regulate your dietary pattern, and try to have a sound sleep. These are the three things which I would like to advise, which you will be able to follow easily.
Okay, so here I would just please suggest me that how much important the psychological well-being for a person who is suffering with the thyroid problem or infertility, where the psychological, or you can say the negativity of thoughts or the stress hormones, how much impact they will put on these problems.
Yes, you're absolutely right. Stress is a triggering factor both in thyroid and infertility. So that the stress can happen from various reasons, maybe because of work, maybe because of family, or multitasking for women. These are few of the reasons why one will undergo humongous stress. So, of course, like I said, stress can be relieved with any form of exercise, and also uh, by reducing your stress, you can focus more on your work, and that will also reduce your stress level, and that will also reduce the probability of infertility. And this stress can lead to high blood pressure, that will further lead to some cardiological disorder like ischemic heart disease. But stress is also one of the reasons for diabetes, type 1 diabetes. So there are many factors which are related to stress. Now, controlling stress should be the key to control many of the other disorders. And the only way is to I personally suggest yoga and meditation along with pranayama. There are many meditative measures like deep relaxation technique and Omkara meditation. All this meditation will reduce your stress level.
So, as you have suggested about the meditation, I would like to request to all the viewers that there is a meditation technique available on our YouTube channel. You can just observe the instructions, or you can follow the instructions and do the meditation, and this is really going to give you an amazing results, as madam has suggested. Now, just one thing, one common thing, always the people will be more confused in that stage, that those who are suffering with thyroid problem, they are usually liking the salty foods. So is the salt somewhere the culprit in the thyroid function, affecting the thyroid function, or how you suggest about the intake of sodium or salt in the thyroid problem?
Yes. See, in hypothyroidism, one of the common reasons of having this malfunctioning of thyroid is because of iodine deficiency. So definitely you have to include iodized salt, particularly iodized salt in your diet, but in moderation. Doesn't mean that you need to overeat, and you nowadays you get something called as pink salt, Himalayan salt, which has less iodine. So please have this instead of the regular salt, and try avoiding pickles which has extra salt, or processed or tinned or canned food which again has salt as a preservative. So stay away from this. You can have fruits and vegetables which have natural salts in that. That is sufficient for your body to have a good thyroid functioning.
So very nice to hear about all the information. Now we are towards the end, and here I would request that if any takeaway message you would like to give to our viewers, you can open to give. Yeah.
Okay. Like I said, I mean, I'm just repeating what I said. Please have a healthy lifestyle. Please try having a proper diet pattern. Please don't ignore your health, because, and please don't ignore your body and your weight. And please don't stress about it, but take good measures by including good dietary habits, a good exercise pattern. And if you're having some trouble, try to um, try to get relieved of it going to a functional doctor or a naturopath or any alternative medicine first, and then you can go ahead with the conventional medicine.
So very nice message. I think everyone should follow that. Do your best. Do your best. Don't stress. Do your best. Don't stress. Leave the rest. So everything will be fine.
Yes.
And as the naturopathy principle says, always that prevention is better than cure. Think that you are going to prevent the problem, rather the problem is going to come and cause in your body. So it is always best that keep the balance of Pancha Mahabhutas, Prithvi, Aap, Tej, Vayu, Akash. Once you are making the balance by utilizing that elements in the nature, and especially you will get the treatments, all naturopathy treatments with using these 5 elements, and you can use at the home. So it is the best part of it. And as beautifully Madam has explained each and everything, and she has covered all the broader aspects to treat and heal the thyroid problems through naturopathy and yoga. So I would like to thank you, ma'am, for accepting my invitation and coming to the Health Talk Show. Really, it was pleasure having you in my Health Talk Show and sharing the experiences what you have achieved throughout your journey. And it is really remarkable that each and everything in a short time you have covered, and definitely my viewers have enjoyed watching you. So thank you so much.
Yeah. Thank you so much, Dr. Gulab, and I would like to appreciate your effort towards health. Hope this reaches more and more people, and hope more and more people get help out of this.
Yeah, thank you, and keep blessings like this only to Health Talk Show, because we are just working for the people, those who are watching us live and also offline. So this is what the message or awareness we would like to create through the Health Talk Show, and that's the reason every day we are bringing the special invitee to our Health Talk Show for sharing the right information of the health, because right information of the health can lead to an wealth, and this health leads to wealth concept will be achieved only when you are healthy, and when you are going to be healthy when you have correct knowledge. So this is what request from our health talk show team, that spread this message to friends and families. And still, if you have not liked our channel, or if you have not liked the video, please press the like button and also subscribe for the notification, because first information reaches to you. So with this, I would like to thank all the viewers, those who are watching us from last 1 hour, and also to the Dr. Kshama ma'am, that she has given the time, taking time from the busy schedule and coming to the Health Talk Show. Thank you so much, ma'am. Thank you.
Thank you. Thank you once again.